And the Senate's bipartisan Gang of Six is working to trim down their yet-to-be-announced health care proposal. But despite outrage from liberals on the left, the Finance Committee might opt to replace the planned public option with a co-op system. Republican Senator Olympia Snowe, a key player on the Finance Committee's Gang of Six negotiating, and she joins us now by phone. Thank you so much for joining us, Senator. I know you were on the phone last night. Can you tell us what came out of that meeting? Are you going to scale it back? And is the co-op still in there as an alternative?
Yes, the co-op is, Andrea. We're not scaling anything back, but we're looking at various issues and refining, modifying, evaluating, and we're continuing on track. I think the recess in many ways is helpful because it gives us a chance to meet with our constituents, better understand their concerns, their issues, and to get a better feel for the greatest concerns that they have regarding health insurance. And obviously they're hearing a number of things about a variety of packages. So I think that it obviously adds to the element of the confusion that is surrounding this very substantive and complex issue.
Do you get the sense that the president is about to give up, Senator, on working on a bipartisan deal with all the pressure coming from the left, from his own party? Is he going to go it alone and try to use reconciliation and strip down the budget and tax proposals and do that piece of health care alone?
I don't get that sense at all, Andrea, and I had another conversation with him this week. He really is anxious to get a bipartisan package and bipartisan support. He understands that having that type of effort that yields broad bipartisan support will, I think, benefit him and the country for a more sustainable policy in the long run as well as in the short term. I think that certainly adds to it. And I think it makes us realize and appreciate, I think, the magnitude of these issues, and that's why, they'll go through various permutations as we work through. That's the way it should. It's representative democracy. But from everything that I have, know, and my discussions with the president, he certainly has embraced our efforts. He is continuing to await the outcome of our efforts, and he understands that this is, a difficult process, and we're just going to have to work it through. But from this standpoint, I do know that he is anxious for us to reach a bipartisan agreement.
Senator, let me share with you something that Speaker Pelosi was asked about. She was asked yesterday, has President Obama given up on the public option? And she said, no, he isn't. He isn't at all. He hasn't. If someone thinks that a co-op can work for their state, that's fine. Perhaps that could be included in their legislation, but it is not a substitute for a public option. So if the House is not going to go along with that, and is not going to accept co-ops as a substitute, where do you find areas of agreement to come up with a final bill?
Well, it's interesting about the whole co-op issue. The co-op is an option, perhaps not for all parts of the country, maybe some parts of the country where it can work. Having the exchanges, it's one of the things that I've learned, during the course of my conversations with my constituents and many stakeholders, that maybe exchanges on a broader basis, regional, beyond state, regional, and national, will encourage a lot of competition among insurers that certainly could be helpful. I think the key is for all of us is to be flexible in trying to, address some of the key and substantive issues. And I happen to think there are ways, of addressing this issue short of having a public option, frankly. And I think the most important thing we can do is to develop a platform for the kind of change that is important. People are worried about change, but the change they're facing right now is the one where you see their premium skyrocketing, losing their coverage, or having diminished coverage. And that's what I've learned through my small business owners here. I mean, they're not even getting the kind of insurance they had just 2 years ago. Now they're paying $1,500 premiums, $5,000, $10,000 deductibles. So that's not the kind of change that people want. We must do everything that we can to help people so that they can have access to affordable coverage. And that's what it's all about. And I would hope that everybody could be flexible in terms of working towards at least a fundamental change in addressing costs and affordability.
So bottom line, Speaker Pelosi says that they will not produce anything that does not include a public option. Do you see any way that the Gang of Six would come out of the finance discussions with a public option?
No, I don't. We have not had the public option on the table. It's been co-ops and addressing affordability and the availability of plans through the exchange. And those are the challenges we're wrestling with to ensure that there are affordable basic plans to offer Americans. I think the key to all of this is thinking about who is uninsured or who is underinsured, and they're all working Americans, essentially. 81% are. And so something's gone wrong with the current system. So if you have health care and health insurance that you like, we want to make sure you can keep it, either through your employer or otherwise. And that won't be the case in just a few short years because of the skyrocketing increases. And that's the kind of change we have to stop that's threatening and jeopardizing American families and employers from providing the coverage.
Olympia Snowe of Maine, thank you very much. A key player on health reform who spoke to the president this week. Thanks so much.
Thank you, Andrea.